Hello everybody, Morty Lax coming to you again from Senior Care EMS with some training tips. Today's training tip is going to be discussing BLS, or really even ALS tools, right? Tools that EMTs and paramedics might use out in the field. So these tools are actually just that. They are great diagnostic adjuncts to help you determine what's wrong with your patient and decide on a course of action for treating your patients. However, don't be fooled by these tools. They are at the end just tools. Ultimately, you need to be watching your patient. Right here is a fingertip pulse oximeter. So I put this pulse oximeter on my finger and this reads, let's say, 50. This pulse oximeter should be telling you how I'm oxygenating right now. If it reads 50 instead of the close to 100 that we're looking for, would you start helping me get ventilated or supply me with oxygen? Probably not. I think I'm looking pretty good right now. In the reverse, if this is saying 100%, but your patient is unconscious, breathing about 50 times a minute, or maybe even less, somewhere around 4 or 6 times a minute, I would venture to think that you should be monitoring that patient and deciding to act not on the number that you see here, but on how your patient is actually acting. Glucometer. The reason I brought the glucometer to the table today is really to talk about its underuse. Glucometers really are a great tool. They're really minimally invasive, and they give you a key number that will help you determine a lot about your patient. They're really underutilized today in stroke patients. It's very important in suspected stroke victims that we make sure that we get a finger stick blood sugar on every one of these patients, because if you think about it, the number one stroke mimic out there is hypoglycemia, or low blood sugar. Low blood sugar is an easily corrected issue, and once you correct that issue, you can continue on your stroke assessment and see if your patient is still displaying the signs and symptoms they had before. So this number is very, very important. Defibrillator. I brought the defibrillator here really just as an impact tool, right? Kind of to offset what we discussed with the pulse ox over here. So same concept. If I put a defibrillator on a patient and my patient is talking to me, but it is telling me shock advised, probably not a good idea to press that shock button, right? So similar concept with this. Make sure that you utilize your tools appropriately. If your patient needs the oxygen, give them the oxygen. If your patient doesn't necessarily need the oxygen, then they don't necessarily need it. Follow your protocols, but use your tools together with your assessment of your patients to make good decisions in your patient's care.